So when I started as an oncology manager in 2011, we did not have any pre-certification or denials processes built within pharmacy. The overall process was that you could write orders same day for our infusion centers, and the patient could automatically receive chemotherapy. We recognized that fiscally, to be responsible to the institution, we needed to have some processes built and in place. We also had patients that started to bring their actual denials from their payer into clinic to say, this actually has been denied, and why didn't you tell me it was going to be so much?
So for the pharmacy department to take on the pre-certification denials management program was a big undertaking. It was a big commitment from our department. But in the end, it just made sense to have this in a closed loop model. So we worked closely with our ISD colleagues to build an electronic referral process that drops the minute a new patient chemo order is written. The team would then take that referral and they would conduct the complete benefits investigation to understand what was the payer's responsibility, what was the patient's responsibility, what would be covered. If a prior authorization was required, this team would then work with the clinicians to get the clinical information from the chart. So they would submit the prior authorization, follow it through to completion, and then document all of this in the chart so that it was transparent to the end user. Our operational pharmacies were heavily involved because in addition to identifying the group that was going to do this pre-certification, we needed that commitment that drug was not going to be dispensed to the patients prior to approval. And this was a pretty significant culture change for our institution. Policies were developed and implemented that included orders having to be written 7 days prior to treatment.
Once our pre-certification program was well implemented, we began to realize that one piece that was missing was management of the back-end denials and write-offs that were occurring with our high-dollar infusion drugs. So at that point, we started with a clinical pharmacist and a denial specialist. And those individuals were tasked with working with our hospital billing group and our coding team, our managed care group, and our patient financial services group. One of the pieces that has proven to be particularly beneficial has been a closed loop, continuous feedback that happens between the denials management team and the pre-certification and proactive medical necessity teams. This allows us to provide real-time feedback as to what we are seeing on both the front end and the back end of these claims and make changes that will support our ultimate goal of reducing both institutional and patient financial toxicity.